Hello, welcome back. The topic today is the problems that can happen in hernia mesh. So we all know in the previous videos we have seen about what is hernia, what are the signs and symptoms, and what are the treatment options and all. In that, the standard treatment protocol is nowadays for any hernia using the mesh repair, whether it's open surgery, laparoscopic surgery, or robotic surgery. Hernia mesh is the standard procedure, and all hernias are nowadays done with hernia mesh repair. Okay, so what are the complications that can happen or the problems that can arise from because of the hernia mesh? It all depends upon mostly what is the type of hernia, how big it is, what are the medical problems the patient had, like diabetes or comorbid conditions, or whether the surgery was done in the emergency, whether the surgery involved other surgeries, or the involvement of the bowel resection, or it happened with the obstructed hernia kind of things. All depends upon the complications can happen, but generally hernia mesh is all synthetic mesh. They're all made up of mostly prolene. There are so many synthetic materials available, but prolene is the most commonly used and is the safest inert material. So the most of the time the people think mesh means it's like heavy. No, most it could be 5 to 10 grams maximum. That is the weight of the hernia mesh. And the most common complication, generally people what they say after the hernia surgery, they will say I have some irritating feel or some burning feel where the hernia mesh is kept. That is a very normal one, but usually that can disappear after 2 to 3 weeks or after 4 weeks of time. Usually it disappears. For some people it can remain little longer, but with a new type of hernia meshes, this is almost the irritating mesh part is almost gone. But the next one is the most important. The problem that can arise or the complication that can arise because of the mesh is mesh infection. Infection is very important in hernia surgery, because once it's infected, the mesh because mesh is a foreign body. From outside we are keeping inside the body. It's a foreign body, so the body has to accept it. And when before accepting, if it gets infected, bacterial infection, that can cause severe morbidities like pain, fever, discharge, all those things. And the treatment, only the best treatment is you have to remove the mesh. So that is the main part. So the cause for infection probably from the patient side, if they are anemic or they are diabetic, uncontrolled diabetes, but they're all easily nowadays manageable. But if the surgery is done as an emergency, or the surgery involves other surgeries like gallbladder surgery, hysterectomy, then the chance of infection is very high. As well as the technique or the experience, all this matters. But once it's infected, the patient will get pain. This infection will prevent the mesh to get fixed that area. So what happens is the mesh will not stick, or maybe the gap will remain the same forever, and the use of the mesh is no longer useful. So we have to remove the mesh. That's the only option. The third one, probably mesh can migrate. So suppose some obese people will be there, so their fat level is high, so usually the mesh is fixed in that area, either with the sutures or some fixative this thing with tackers. When that most of the time the doctors will advise the patient not to do certain activities for some time. Avoid going to gym for 2 months, or don't lift weights, all these things. When people don't do that and they're obese, then the mesh can migrate, leading to recurrence of the hernia. So the recurrence of the hernia nowadays is very less. It's usually 0.03 to 3 percentage. And the same way, the infection rate those days was very high because of with the advent of the modern technology, the mesh, the antibiotics, choosing the patient, surgery. The infection rate has come down from double digit numbers to now remains to between 1 to 8 percentage. So just because of these problems, you don't have to worry, because these are all very rare and easily addressable. But hernia can get into complications. So see your doctor, get all your doubts before the surgery, and follow his advice. Thank you.